Hello and welcome back to the show. Today I am joined by Meredith Woolsey, a very special guest. She's from Move to Live in South Australia. Meredith is an exercise physiologist whose work is grounded in creating truly inclusive healthcare. In the conversation that we have today, we focus a lot on weight stigma, what it actually is, how it shows up in healthcare, and why it really matters for us as exercise professionals or healthcare clinicians in general, because I know there's a lot of you who aren't EPs listening to this. Meredith shares a lot of insights into how we can shift our approach to ensure that every client that comes into our clinic or within our services feels really respected, supported, safe, but also most importantly, welcomed. This is a really important conversation for anyone working in healthcare. And I'm really, really excited to share it with you. I took away so many things from this conversation, especially being that this is something that I haven't had in my personal workplace environment or a big focus on this before. I haven't had much exposure to this. So I want to say a lot of perspective changes and shifts and things landed a little bit differently the way Meredith spoke about it. So I'm really excited to share this with you. I hope that you enjoy it. And yeah, let's get stuck into it. Hello, Meredith. Welcome to the show. How are you?
I'm so good, Courtney. Thank you so much for having me. I'm excited to be here.
I am excited to chat about this too, because it's been a long time coming. We've tried to organize this a couple of times and
Life.
it's just life. Exactly. Life has got in the way.
So
But anyway, I want to kick off this episode with talking just about you, who you are, where you're from, what you're doing. Do you want to share?
I would love to. Thank you so much. So hello, my name is Meredith. I am an exercise physiologist in Port Noarlunga South in South Australia. So I live and work on Ghana land down here. And I always just take a moment when I talk to people just to let you know a bit about myself and what my privileges are, just because, everyone's got different stuff and lived experience going on. So I am a very boring human. I am white. I am in a heterosexual relationship. I am cis and I am pretty able-bodied when it doesn't want to be annoying at me. Highly educated, because we're going to talk a lot about weight stigma today, I'm in a straight-sized body. So what that means is basically I'm pretty straight up and down. I am what you would imagine a body to look like from a quote unquote normal point of view. Even though bodies are very diverse, it's kind of what you imagine a body to look like. It's pretty just like, oh yeah, it's just a body straight up and down rather than being a bigger body or a smaller body. So, and there's a lot of privilege with that because it means that, I can walk into a shop and buy clothes or no one gives me unsolicited weight loss advice on the street or whatever. So they're all the kind of privileges that I have basically. So I run Move to Live exercise physiology down here, which is delightful. It's been going for about 9.5 years now, which is just bananas. I can't even get over that.
Congratulations on that. That is huge.
Yeah, for like 6 years, it was like just me. And then I hired staff, and now I have four EPs working for me and an admin plus myself and the therapy dog at the clinic, which is always
Hey,
nice.
therapy dog. So cool.
Yeah, she's my baby. So she comes and we have therapy dog Thursdays, and she's here to support all of our clients, which is lovely. And we are small but mighty, is how I always describe us. And we are a size inclusive, weight neutral clinic. And we strive really hard to be neurodivergent affirming and to be LGBTIQA plus affirming. So we try really hard to be as safe a place as you can make it for people to come and move their bodies without fear of judgment. And that's what we do.
That is, I feel like you say that like it's like, yeah, just the usual.
It's the huge.
And every
Yeah.
time I speak to you, I'm like, man, I am so not like we're so different in what we do, but it's still so cool. Like
Yeah.
even your terminologies that you use, I'm like, wow. I actually, when you said that straight size body, I was like, what would I actually say about me? Because I'm
Yeah.
like, is there an hourglass one?
Yeah, like you can call it that. Generally, like if you would not be considered like in a genuinely bigger body or like in a fat body as a person in society, then you're like in a thin body or you're in a straight size body. So you know how you have white privilege or male privilege? There's
Yeah.
also like thin privilege because you just get to walk around and you're not worried that the chair's going to fall out from under you, and you are not worried you can't get through that gap, and you're not worried that you're not going to be able to find clothes that fit. Like
Yeah.
It's that
Yeah.
same thing. It doesn't mean your life isn't hard and it's not challenging in other ways. It just means in that very specific way, it's like, oh yeah, actually that's fine. So
Yeah. Yeah.
yeah.
Definitely don't.
Yeah, right.
But
So
I can, yeah, it's such a crazy world. I'm not really in that type of like space with my work, and I work only in the pelvic pain space, really. So
mm,
none of that conversation ever comes up. So today's, for anyone listening, today is probably me asking a million questions because I actually don't know a lot about this, and I'm extremely excited to learn about it.
I
Um,
love questions.
so if anyone else is like, "What is that?" then I feel yeah, because I'm the same, which is cool because I think the stuff that you talk about is also, or that you're quite passionate about and who you see, is also a little can be a little bit of a scary space for people who haven't entered into that as a clinician. So for me, like sometimes I hear those words, I'm like, oh, this is I don't know a thing about this. I almost don't want to touch it. Like, how do you even go about this when, like, there's nothing that you like you just haven't ever been in that environment ever and you just don't know how to deal with it. So we're going to talk a lot about that because I
That
feel
sounds
like
good.
there's so much, so much we can do in the space or the people that we see have these experiences and being aware of them, I think is so important. So,
Yeah, and you're so right, Courtney. Like being aware that it's a thing that happens, that like, excuse me, weight stigma happens, and that people get, harassed for their weight, and they get not as good medical treatment because of their weight, or because of the color of their skin, or because of their sex or gender, or because of all
mm.
sorts of other things, because of their disability. Any marginalized or minority group, that's not good, and we need to be aware of that. And so, just in case people don't know, a minority group is a group that is like there's less number of people. Okay, so like the queer community, for example, would be a minority group because there's less people. It's like 10% of the population across that whole group than the straight people, which is 90% of us. And then but they're also a marginalized group because that is a group that is like treated less than, or like picked on, and pushed to the
Mm.
margins. Like that's what it means, right? Not celebrated as the norm. So you can be just a marginalized group, but you can be a large group, or you can be a minority group, so a small group, and also be marginalized. So that would be like the queer population, but like with weights.
Yeah, okay.
That makes sense.
Yeah, I've never ever even thought about that. I'm
Yeah,
like,
so
oh, that makes sense.
they're slightly different. So for example, people in bigger bodies, they are not a minority. Like that's actually the majority of our population in bigger bodies,
Mm.
but they are marginalized because you only have to see the comments on Instagram when someone in a bigger body posts themselves doing something, or posts themselves in a bathing suit. Like it's brutal, right? So
Oh
they're
yeah.
right. So they're a marginalized group. They're pushed to the fringes. They're not considered to be good enough, all those sort of things, but they're not a minority because
Yeah.
they're a huge part of the population,
Yep. I
right?
see.
Yes.
Super clear. That it actually makes so much sense.
Oh, good.
It's like when
Yes.
you hear things that just land so differently when they're said in different ways, and I'm like, oh, that just like hit a light bulb for me.
Yeah. Oh,
I feel like
good.
there's
I'm
gonna
so
be so
happy
many.
to
There's
have
gonna be
helped.
so many in this call,
Yeah.
which is so cool. But I know I want to talk a little bit more about your clinic and your
Okay.
work because it's cool. But how did you get here? I know you actually have written in your bio like you went the long way round, but finally kind of like found your place. So can you explain that for us?
I would love to. So, for the vast majority of my childhood, I was going to be an astronaut because I was very nerdy. I went,
Wow, that's so cool.
I went to space camp in America, like a summer camp, like
Stop it. Did you really?
I really did, like we did
Oh,
like
wow.
rocket launches, you're in mission control one day and then you're flying in the shuttle the other day, and went in an underwater scuba tank and did like astronaut missions, like how the astronauts train in underwater. So like just nerdvana. It was just great. So
I
super
did
nerd.
not know this about you. This is so
No,
cool.
it's my deep dark past. So I was going to do that, and my plan was to basically be a science officer astronaut. So do experiments, that sort of stuff. I love science, massive nerd. And then I discovered I'm pretty terrible at maths, specifically calculus. Real bad at calculus. That's why I'm an EP, because I only need to count to 15. So much
Maybe
easier.
even 10.
If we're lucky, which is all of my fingers, so it's okay. It's when we get to 15, I have to start using my toes. That's when I really start to struggle.
You
Um,
got them toe socks, don't you? Toe
yeah, precisely. So I failed a bunch at uni because of the massing, but also I got glandular fever and it really affected my brain. And so I failed a whole bunch at uni because my brain just wouldn't keep up. And so I was like, right, I'll do my second love, which was outdoor education. Loved going on camps, did the Duke of Edinburgh scheme, all of that sort of stuff. So I was like, right, I'll go teach outdoor ed. Went to go do that, but I'd been 2 years at uni, so I didn't have back then it was called a TER, but now it's called an ATAR. I didn't have an ATAR anymore. It only lasts 2 years. I was very young graduating school, so I didn't qualify for adult entry. And my GPA was terrible because I'd failed everything because my brain stopped working with the calculus and with the glandular fever. So I went to TAFE to do outdoor ed. And I was given incorrect advice. I went to do outdoor ed and I got told I needed to do a diploma in fitness, which was actually incorrect. But I did my diploma in fitness. And while I was doing my diploma in fitness, which was 2 years at TAFE, we had an exercise physiologist come to talk to us about what to do when we should refer on.
Yeah,
And
cool.
I was just like, oh my God, that's what I want to do. Yeah. So Fiona Belton, if you're listening, it is all your fault. She's still an EP in South Australia. She lectures at uni and runs her own amazing business and works a lot in return to work here. And it's all her fault that I am an EP because she was the one that stood up and told us all about it. I'd never heard of it before then. So I'd done 2 years at uni by that point, 2 years at TAFE, and then I went and did 4 years at uni to become an EP. So I did 8 years of tertiary study in total. Which I would not change because I take things from all of those degrees and qualifications on board and they're all very helpful. But yeah, it took me 8 years to become an EP. So that's why I say, that's why I say I came to it the long way around like that. Because it was, and all through that last bit as well, it took a long time for my brain to work the same way again, for it to catch up again. So like I was fighting, clawing my way back through that. So yes, I'm very proud that I did that and I never want to study again.
I know sometimes I'm like, oh, maybe I could just add like a master's degree or like do some research. And then all I have is these thoughts about group assignments and like having to submit assignments and read. And I'm like, no, not for me. Brain is just like it throws that thought out the window straight away. I'm just like, it's not even worth it.
Yeah, 400%. I agree with you. I think my mum always says that I need to be captain of my own ship, which is why I run a business, apparently. I always tell her that I think really she just means that I don't play well with others, but she assures me that that is not what she means by that.
You never listen to people above you.
Yeah, like legit. It's like, no, you want to steer it in the direction you want to steer it, and that's the way you want to go.
Yeah.
So that's how I became EP, basically.
And then so when did you start, like where in the journey did you start Move to Live?
My second year out.
Yeah, so you went straight to like working for yourself pretty much.
Within reason, yeah. So I worked somewhere that was not terribly nice, very narcissistic boss, very unpleasant, toxic work environment, not a good plan. And then I lasted there for 10 months and I was like, okay, bye, thank you so much. And I was also working somewhere else for this person who had her business. And I was like, right, I really want to sort this clinic out. Like, these are all the things we want to do. And she was like, oh, actually, I don't want it anymore. Do you want it?
Oh.
Of which it really wasn't worth anything because it was in such disarray and it was a whole thing. But I was like, no, because I want to work for somebody else. I don't want to run this. But anyway, I did. I took it on. I paid her just like goodwill for some of the little bits of equipment we had. She kept her name, which was fine because I like my name better. Because it's Move to Live, right? Like that's why we do it.
Yeah.
Not everyone wants to exercise for the sake of exercise. Like if you do, that's great. And I'm very happy for you. But for the vast majority of people, it's not actually a super amazing experience. And so I'm like, no, we do the boring little pissy exercises so that you can do the thing that you actually care about so that you can live.
Yeah. I love that approach to it because I feel like EPs could go either way. Like they love exercise and they want to promote it. And others are just like, I hate this. Like I do this so I can manage my health.
Yeah. I have never had a gym membership. I hate gyms.
Well, you've got your kind of like your own.
Yeah, right. Like I made one for myself, but I just have never had one because I don't want one. Yeah. And I think the EPs that are very, like, again, I'm really happy for you that you really love exercise. And I think you really have to check yourself when you're talking with your clients, because like that is not the vast majority of people. A lot of people have a lot of terrible experiences with health professionals and in gyms and for various reasons, or maybe they have sensory issues and they're like, I really hate the feeling of my body getting hot and sweaty because it's really awful and I don't like it, and so they haven't done it, or they had asthma as a kid, or like my partner was really sick as a kid, so he never got to play sport or learn to swim or do any of those things because he was a sick kid. you
Yeah.
know
So like
I
it's not fun.
experience, no, it's not fun. So I think it's a very privileged position if you grew up loving movement and exercise and your body loved movement and exercise and you got to do that,
Mm.
that's really cool. And also you got to just remember every now and again, they're like, oh yeah, that's right. That's not actually all of the people. And some of those people are the people in my clinic, and maybe I shouldn't, just expect them to magically drop and give me 20 because they're
Yeah.
probably not like
But
that.
you can't count to 20 anyway, so
And I can't. So
that's why we do 50. Um, so like how did you like where did your passion for all of the I want to say like equality in healthcare come from? Does it have you just grown up like that as like is there something that like that did that come from somewhere in particular or an event, or did you just feel like I really care about this as a generally as a person?
I think the time that I realized is a very specific point in time, which is from what my absolute best friend, we've been best friends since we were two. She is an eating disorder dietitian and she is a non-diet dietitian. So same as me, weight neutral, that sort of stuff. And I was talking about this client who'd had all of these issues going on and had just been told to lose weight and that would solve it. And I was like, well, that's done. We need to get her strong and we need to do these things. We need to do all this other stuff. And she was like, Meredith, I think it's time that I tell you the thing. And I'm like, what thing? She's like, you're really weird. I'm like, well, I know that. Have you met me? You've known me for 25 years, woman. Like, get it together. Anyway,
Great
she
friend,
was
she's so
like,
honest.
as a healthcare professional, you're really weird. She's like, you don't focus on weight, you focus on all these other things. And I'm like, well, yeah, because that's not always in your control. Like my mum, her thyroid is dead. She has to take thyroxine. She has since before I was born. She's always been in a bigger body. So I am very privileged that I always knew that it wasn't always somebody's fault
Mm.
they were in a bigger body. And also, as a side note, it doesn't even matter if it is their fault. They are still deserving of respect and
Yeah,
appropriate. Yeah.
as a human.
Yeah, as a human, right? Who would have thought? But put that over to the side. But so from a very early age, I understood that there were multiple factors that could influence someone's weight, shape, and size. And so that was very helpful. But my friend Tierney, she was like, oh, not other people think like that. Think about every other health professional apart from me that and think if they think like that. I was like, oh my God, you're right. They don't. And she was like, yes. Now, welcome to the world of size inclusive healthcare. And it was like, she opened this little door and there were all these nice people on the other side. I was like, oh, hello. So I was always a little bit like that and
Mhm.
always wanted to fight for the little guy. I distinctly remember when I was a student, baby Meredith, walking past a building that is now a doctor's clinic. And I went, oh my God, that would be so cool. And you know what I would do is I would make the door really wide because then it would be really good for people who are in really large bodies. And people with wheelchairs could come in. And I would like help all the trans people to feel more comfortable in their bodies and for their body to look the way that they wanted. And we would help all the underdogs. That was 15 years ago. And I've kind of
Wow,
almost accidentally created it. And I didn't really realize that's what I was doing. And now I kind of have. And I'm like, oh, it's really nice.
that is
Um,
cool.
yeah, so it's always been there, but I don't think I had the language to know what I was doing. And I was just doing it because it felt like it was the right thing to do to basically not treat people like a sack of crap, which is so often the case. Like guilt and shame and all of those things so often come into healthcare. And I just don't think they have a place in healthcare. I don't think that. Because if guilt and shame worked, everyone would be quote unquote healthy and everyone would be skinny.
Yeah.
I actually think that children should always be blind weighed. So what blind weighed means is that, sure, you weigh them, you've got to monitor their growth and, you need weights for drugs and stuff like that. That's perfectly reasonable. You don't tell them. It's
Yeah.
blind to the person. You don't know. For anyone listening, you can request that from your health professionals. If hearing your weight is really triggering for you, you can tell them that you want to be blind weighed.
Do you think that's something that we could ask our clients? Because I'm just thinking of people who are listening to this that might be still doing like a GP report that's been sent for diabetes or something where we're required to like do these types of like all these different measures. And if that's
Mm.
something that maybe they're doing in their clinic, maybe they work for people who do that in their clinic. Do you think it's something that we should say, like, would you like to say, like, do you ask that?
Uh, well, a couple of steps back that I would do is I would actually question, do we need to weigh them?
Yeah.
So, for example, okay, let's take you have a type 2 diabetes referral, you have the full medical history there and all that sort of stuff. It's probably got the weight on it. Why
True.
weigh them again? Like, why do it? It's not relevant. It's right there. They had their meeting with the nurse somewhere in the last 2 weeks.
Yeah, okay.
It hasn't moved. Like, do you know what I mean? Like, it hasn't gone anywhere. It's the same. Just don't do it. Like, is it clinically necessary to know their weight? Probably not. For
No.
me, I find that there are three reasons as an exercise physiologist, very different if you are another health professional who is dosing out medication, if you are looking after someone who has an active eating disorder and you need to make sure they're not getting, that their weight is restoring, that sort of stuff, very different. As an exercise physiologist, I find there are three reasons to weigh people. In no particular order. Reason number one, they are a cancer patient and they are seeing me more regularly than they're seeing anywhere else. If you have lost 5 kilos in a week as a cancer patient, you need to see your oncologist yesterday.
Yep.
And you need to be going to the dietitian and you need to be getting better supplementation. And we need to be sorting that out because the quicker your weight drops, the worse it is going to be. Right? So that's one. Number two is uncontrolled heart failure. Because if you are, which I don't really tend to deal with because cardiac is terrifying, but
I agree.
nope. But if I had someone with uncontrolled heart failure, we're talking like fluid retention issues. If you have put on 5 kilos of fluid, then probably something is not right. And I would like you to go to the emergency room, please.
Mm.
And it's the same with uncontrolled lymphedema. Again, if you have suddenly put on 5 kilos of fluid, oh, are we heading towards a cellulitis issue? Is something blocked? What's happening? Please go to your doctor. Like, I'm not going to exercise you.
Yeah, and those aren't about weight, really.
No, they are about
It's
safety.
yeah, and like physiologically is something wrong.
Precisely. And I'm like, okay, this is a point where we need to pivot for your safety to do something different. Apart from that, I genuinely don't know why, as an exercise physiologist, I would need to weigh someone. Because somebody else is probably going to do it. Like, even, it's like, okay, let's say that the goal is weight loss for whatever reason. Okay, but they're going to go back to the nurse or they're going to go back to the doctor. They're going to do it. Why do we need to do it? We can be the space that doesn't do it.
Yeah, which would
Still
blow
going to get
some
done.
people's mind being the exercise person that doesn't do it.
Oh, the amount of tension that leaves my clients' bodies when I say that we will not be weighing or measuring them, honestly, it could run like a power plant, the amount of tension that just removes from them. Like their shoulders drop, they sigh, they're like, oh, really? I'm like, yeah, man, we don't need to do that. You know, you probably know your weight anyway. Like,
I
and
was going to say, I swear most of those people come in and like know it anyway.
because it becomes the center of their universe and because they're told it's the most important thing about them. There are so many more important things about them from not only a medical point of view, but also a personal point of view. If that's all you're seeing is someone's size and that's the only reason you're prescribing exercise, I'm like, you are wanting in your clinical assessment.
Mm.
It's not the main reason. The reason you should be taking someone's size into account is to take into account their lived experience of one, they have probably had a whole bunch of really, really, really terrible experiences in healthcare and in fitness. And so maybe try to not be a dick about it. So you should be taking that into account. And also, you just need to know that bodies move differently when they're bigger. Like, if you are trying to get someone to lie on their front and they've got massive boobs, that's probably not going to work. How much gym equipment do you think was designed by blokes? Honestly,
Yeah.
boobs do not factor in, right? Or if you're trying to do, okay, my easiest example is always a seated hamstring stretch, right? So you come forward on the chair, you have one leg out straight, one leg bent, and you lean forward. And in your world of like, let's do lots of pelvic girdle pain and endo and stuff like that, if you're leaning forward and your uterus is on fire, that's not going to be a whole lot of fun. But if you're leaning forward and you have more of yourself in that front belly area, you're going to get smushed. So instead, what you should do is you should separate out your legs and then lean over to that side. And then there's room for your tummy.
Mm.
So providing appropriate prescription for a person in a large body is to clock their body and go, I don't think that thing I normally do is going to be super comfortable for you. You know what? I'm just going to teach it this other way rather than teaching it. And then they have to advocate for themselves and go, oh, actually, Courtney, that's really not very comfortable.
Yeah,
Because,
which is actually quite challenging when you haven't had a lot of experience in that space.
yes.
Um, I get this question quite a lot in because I do a lot of like deep core stuff and a lot of people like don't know if they're actually doing it well. And so, we do a lot of palpation work in my world. Well, I don't actually do it because I'm online, so I never touch anyone. But like I get a lot of clients even from anyone inside like the mentorship program is like, what do we do if we're not sure if they're using, like if they're contracting through their pelvic floor or they're using their abs properly, because that's such a hard thing to do. Like when people are bigger, do you
Mm.
do that? Do you actually palpate or do you tell them what to do? Or like, what do you do? Like I'm assuming that you don't do any of that or like palpation work, or how would you
Do like I
navigate?
don't, yeah, for core, for like just normal core sort of stuff. Yeah. So if, when you do the whole like, okay, there's your like ACEs and you kind of come in a little
Yeah,
bit.
yeah, for like deeper abdominal wall.
If you've got someone who is in a large body, do not just start at the outside and try to shove through it. It will not work. And also it'll be really uncomfortable. But don't know
Yeah,
when the last time someone
everyone.
poked your belly was. It's not fun. So if they have a larger body or rolls or things like that, and because when they're lying on their back, we do that generally, obviously. And so you can come in underneath that and kind
Yeah,
of
yeah, like
move things
cargo.
out of the way to a point and then do it. If it is not comfortable for the client, also you might have a client, it's not just people in bigger bodies. It's like, please don't touch me.
Yeah,
I'm a sexual assault survivor, or
yeah.
I'm really sensitive, or I'm really ticklish, or I don't know, whatever. I have shingles and it hurts because I
Mm.
have
The
neuralgia
pain.
now, or pain, or whatever.
Yeah.
Come on, figure it out. Do the gold standard for that person,
Yep.
right? And if they're happy for you to palpate, great. Like the answer is to upskill. The answer, and I'm not saying this is not what you're saying, but the answer is to upskill, which is great that they're asking questions. The answer is not to go, I'm sorry, I can't help you, go lose some weight and then come back.
Oh yeah, no.
This is not
I
what you're saying, but
yeah.
that's what happens in other versions of healthcare. If it's like, oh, well, just go lose some weight and then come back. I'm like, I beg your pardon. You treat the person in front of you, be better, or refer to someone who is.
I
End
would
of.
never say that to someone. That wouldn't even come into my mind to be like, oh, sorry, I can't help you. Unless like I actually didn't know anything about their health condition. If someone
Yeah.
came to me with like a stroke, I'd be like, I can't help you. I don't know
Boom.
what I'm doing. But like for that, I can't believe people say that.
Oh, all the time. People are denied healthcare all of the time because of their weight. People are not given the gold standard of healthcare all of the time because of their weight.
Yeah, right.
Yeah.
So can you tell me a bit about like your clinic in terms of its inclusivity? I know there's a couple of things I'm like dying for you to say that I'm like, I know the vibe of your clinic, but I want you to tell everybody.
Okay.
Like the door, for example, the door. Like that
Yes.
would not
Well,
that
I
people
must admit, we don't have the amazingly uber wide door that I wish that we had, but
like,
that's
we don't
okay.
have doors. Everything's just open.
Yeah, but for example, our we have the tiny plinth massage table that you can see behind me, but in the other room, we have a plinth that is weighted to 400 kilos while moving. It is also,
Whoa.
yeah, it is also 1.2 meters wide,
Yeah, wow.
three different face holes. So it is, and it goes all the way down to wheelchair transfer height and then all the way up to about my boobs when I'm standing. So it's very accessible. So it means that multiple people, so your support person can get on with you, your dog can get on with you, we can get on with you. We've had two of us before doing stretches on clients with lots of spasticity and we're all on the bed and it's fine. And the bed can move with anything up to 400 kilos on it.
When you say move, do you mean like up and down move or like
Yeah.
rolling?
Well, I could also do that, I suppose, but
Oh,
no, up and down is what I mean.
yeah,
Whereas
okay.
a lot of the beds, because they have that crisscross thing underneath them, that's how they move.
Oh, yep.
The hydraulic and they move straight up and down. That's
Yep.
why the weight is so heavy. And often it's like, yeah, this is weighted to 300 kilos, oh, but only 120 kilos while moving. And I'm like,
Oh,
I bet what?
that's not
Because
too
it's
bad.
cross mechanic, it doesn't work the same way. So I was like, well,
Yeah.
that's not Because what if I need to put them on there because they need to get out of a wheelchair and then I need to lift them up so that I can do something with them?
Mm.
That's dumb. And so I bought this one. It's also bright green, which is really lovely because that's our clinic
Cool.
color. Um, so that's really good because yeah, it's not an issue for anyone to get on that of any size. And it's also really good for people with pain because, you know, when you get on like a bed, you have to rotisserie chicken and like go around yourself. And it's really hard if you're in pain because it's so wide. It's wider than a leg. You just roll
Yeah.
or you slide because it's, you know, quite nice and slippery. And so like it's really accessible for people to do things on and for us to do things with people on. So that's an example. All of our chairs are heavily weighted to 150 kilos, which I know doesn't sound like a lot, but if you go to IKEA, pretty much every single chair there is only weighted to 100 kilos.
Is it?
That is not a lot. That is me with a child on my lap.
Yeah. That's crazy.
And so you can imagine that if you're walking into a clinic and all you can see is these very beautifully designed little skinny Scandi chairs with no oomph behind them, or they all have arms and they're really small,
Arms.
you don't belong there. Arms are great sometimes when they're wide enough, but if every single chair is like really tiny little arms that I can barely fit my ass into, it immediately signals to people that you're not welcome if you're in a bigger body and it's not designed for you at
Yeah.
all, right? So all of our chairs are really heavily weighted. All of our equipment is really heavily weighted. Like when we bought a reformer, I spent a week researching to find the most heavily weighted reformer that I could find. And we paid the extra money to have the extra high legs put on it so that it was more accessible to people getting on and off. All of that sort of stuff. Yeah, so everything that we buy, size and accessibility is in mind. And then other ways, so we tried to be neurodivergent affirming. So we have dimmers in all of our rooms and in our waiting room and in our gym area, so we can adjust it, the light sensitivity vibes. We have fidgets in all of our waiting rooms, not in our waiting rooms, use words, Meredith, consult rooms, so that they're there. We have tissues in all of our things, so we make it very clear that it is like acceptable to cry because we talk about really hard things. We have our in the waiting area, we have our Learn to Live library, which has things like a toilet stool on there to be like, hey, we might be asking you about your poop and all this other stuff, and that's okay. We have on the library shelf, you see, you know, books about all sorts of different bodies and all sorts of different really cool things. So it's very clear the sort of vibe we are. We have the little welcome here rainbow heart. We're part of that program so that you can clock really quickly if you're queer or you're an ally, that you're like, oh yeah, this is a safe place. We have a giant poster in our waiting room that says trans rights are human rights. We have our pen holders are actually little cups that look like really beautiful, voluptuous bellies. And so and we have things that it's like, you know, everybody is welcome here with like pictures of different bodies and, you know, movement on your terms. And we have on our client intake form, we ask people's pronouns and their sex and their gender, or if they're intersex. We ask for cultural things. We don't ask for their height and weight, funnily enough, who would have thought? We don't have mirrors in the gym.
Any mirrors?
No, none. Partly, honestly, because I am like a bowerbird and I'm like, oh, look, color of movement. And I get distracted.
It's actually for you. Yeah.
My first job with my narcissistic boss, the entire wall was mirrors and the entire other wall was the window. And it was like a fishbowl. And people could see in and watch us the whole time.
Do you have windows like that, or are they frosted?
Yeah. No, we have blinds. So we can see out, but they can't see in.
Yep.
Yeah.
Yep.
So
What do you do with people like, I love the whole mirrors idea because I can see, like, I used to be in personal training. A lot of my clients wanted to like face away from the mirror, which I was like fine with. I wasn't worried about it. But I was like, so many times I was like, just see how you're doing that. I wanted to show them. And I was like, how do you tell someone they're doing it wrong when you can't get to look in the mirror?
Well, for starters, the vast majority of our clients are not doing huge big lifts and things like that.
Oh,
like
okay.
it's not generally the version of stuff that we're doing. However, if push really comes to shove, I film them
and they're
and
okay.
I show it. Yeah, because I'm like, I just want you to do it. If I can't demonstrate it the way they're doing it, or we can't get that to work, I'm like, what I'm going to do, with your permission, what I'd like to do is just film you doing it, 2 reps. I'm going to show you so you can see, and then I'm going to show you that I'm deleting the video.
Yep.
And most of the time that's fine. I don't
Yeah.
often have to do that. Generally, I can get away with it with my throwing my own body around the clinic, how it needs to be done, or with, your
I guess you can sort of like put them in the like help them. I'm
yeah.
thinking of also the people who just like, they just have no body awareness. And you're like, but you just need to like move your shoulder. And they're like, where? And there's like flying.
Yeah. And so,
Yeah.
but it's like, okay, well, I can demonstrate to you and I can use my words and I
Yeah.
can ask permission to touch you and I can do all these other things. And, like there's 10 other steps
Yeah.
that I can do. If push comes to real shove, then I'm like, all right, fine. Like I'll film you and I'll do it. So we've just made the decision to not have mirrors. To have mirrors and then to have a curtain over it would also be very reasonable for me. I'd be fine with that as well. I just
Yeah.
don't have it because we also have things like kids running around the clinic. I'm like, oh God, don't break them. Don't break
Yeah.
them. It's
Yeah.
very
It's like a
stressful
wall face.
when you break it.
Yeah.
So yeah, so I just don't have to worry about it. So no, so we don't have that. And it's because it's not really needed with our particular cohort of what they're
Yeah.
doing.
I was
So
just thinking, when I'm online and I've got someone in like a bird dog and I'm like, you just need to lift because I can't touch anyone and like
of course you
put my
can't.
hands on them. So I'm like,
Yeah.
my cueing is pretty good, but
Yeah.
sometimes they just do it so wrong, and I'm like, can you see yourself in their like in
Yeah.
the video? And they're like, yeah. I'm like, can you just look at your back and just pull
Yeah.
up a little bit? And they're like, oh, that's what you mean. And I was like,
Yeah.
that's what I meant by like, how do you tell me? But
Yeah.
I've got the layers of like, can't even.
Yeah. Right. And you've developed the skills that you need to work online. We've
Yeah.
developed skills that we need to work without mirrors.
Yeah, I would just love to come. I should come to your clinic one day and just come
One
in because
day.
I'd be like, my mind would be blown. Like it's so different to anything I've ever been around for
Yeah.
me. And I think it'd be so, so cool. But
Well, if you really
um,
want, I can take the laptop for a walk and I can give you a
you can
tour
do that.
for
No, but
them.
like even just experience the clients, because like
Yeah.
they're so different to who I would see.
Yeah. Yeah.
Um,
And a bunch of them are just very your run of the mill, I need a knee replacement or I have Parkinson's. Like not everyone is like, I have had the world's most horrible weight stigma experience and I have a raging eating disorder and I have all these things. Not everyone is that.
yeah,
And for some people, the whole, the weight neutral thing, they're like, oh, okay, that sounds nice for the people who need it. Great. But they're fine. There's a lot of that as well. But for the people who need it, it is life changing
yeah. Oh, I can
because it
imagine.
is the first place that they have felt seen and they have felt heard and they have felt not judged on the way that they look and they felt that they have been listened to and that I'm taking them seriously and that my staff are taking them seriously for whatever they've got going on,
Mm,
rather than just being told, well, if you weren't fat, it would be fine. This is your fault. You have done this to yourself. And we know that that is utter bollocks for so many things. Like, for starters, we really don't know how the human body works, but also like there are huge genetic components for just about everything,
mm,
right? And
yeah.
even if it is quote unquote your fault, you are entitled to respectful, equitable healthcare. And we will do a definition. So equitable versus equal, very similar to marginalized versus minority. So equal means that everybody gets exactly the same. Okay, you get 5 apples, I get 5 apples. Joe, who also owns an apple farm, gets 5 apples.
Mm,
Joe probably doesn't need to be given 5 apples, okay, because he's got his own apples. Equitable, or what we're after rather than equal, is that everybody gets what they need,
mm,
right? So you have a deficiency in vitamin, whatever the hell is in apples. So you actually get 10 apples. I'm just average Joe. I get 5 apples. Joe has a freaking apple farm. Joe doesn't get any apples. Joe
yeah.
might get a subsidy for providing apples to other people, right? So that's the difference between equality and equity. Equity is everybody gets the amount that they need and the
Yeah.
type of thing that they need, right? So what we really want is we want everyone to not have equal healthcare. We want everyone to have equitable healthcare. Think an EPC. An EPC is an example of tiered equitable healthcare. If you don't have 2 or more chronic conditions, you're not entitled to it. When you have 2 or more chronic conditions, you're entitled to it. However, if you have 10 chronic conditions, you're not entitled to any more. You're still only entitled to 5, even though really you might need 25,
Yep.
right? So that's an example of equitable to a point, right? So it's helpful to a point. Same with my aged care, right? You have a level 1 package, a level 2, a level 3, a level 4. You are assessed to work out which of those packages you should have.
Mm.
If you have more needs, you have a level 4. If you have far less needs, you have a level 1. Your funding differs. That's an attempt to be equitable.
How do you go about approaching other healthcare providers about all of this stuff and creating referral networks?
Um, Well, I'm very lucky that I've developed over the years a lot of friends who are in this space, which is really nice.
Mm.
I have a lot of friends who are dietitians, and they're all weight neutral, size inclusive, non-diet sort of vibes, which is really lucky. If you're looking for health professionals who are size inclusive Health Australia has a registry of them. I'm on it. You will see my delightful face on there. And so you can go looking for people there and make connections. There are like Facebook groups and things like that. In South Australia, we have a quarterly PD, like a peer PD session that we run. For people to, upskill, and then we have socials and stuff like that. So part of the community we've kind of created ourselves, and part of the community has already been around. Social media and stuff like that is really helpful for all of those things, searching like health at every size or size inclusive healthcare and things like that as tags, you will find people. So that's kind of how we've done that. In terms of, we also have people that we refer to who are not 100% size inclusive. So for example, a physio, he used to be my physio, who I used to refer to quite a bit. He's just moved too far away now. It's a bit hard, particularly for knees. He was really into knees. I didn't make him size inclusive, but we did get to the point that he could tell me which knee surgeons were really fat phobic and which weren't.
Oh, wow.
So he got to that point that he was like, yeah, that guy's going to give them a real hard time, but this one won't so much. So I'm like, okay. He didn't say that they shouldn't give them a hard time, but he could tell the difference between the treatment.
Yeah.
And we also got to the point where anyone that came from me, he knew that weight was not to be discussed.
Yeah, okay.
I didn't know what he did with any of his other patients. But with mine, he would toe the line because he's like, no, I know that's how you practice and that you're referring to me out of a trust that I'm going to stick with that for them. I'm like, yeah, because I want you to make their knee pain less so that I can get them strong so they can support their body. If their body's big, that's fine. It just needs to be strong.
Mm.
To
Yeah.
support that frame. Them going on a massive weight loss kick is, yeah, sure, they'll lose some fat. You know what they're also going to lose? Muscle. What is the least helpful thing to do when you have when you're coming up for surgery, when you're coming up to being pregnant, when you're coming up to just about anything, to lose muscle mass and bone density, which is what happens when we restrict.
Yeah.
Like, it's really dumb. People
Super
go,
important.
let's just take the force off. I'm like, well, let's make your body be able to handle the force by producing its own force of being strong.
Yeah, and like the behavior or the relationship that they build with movement and exercise just from that approach alone completely changes, doesn't it?
Right. And that's so much better than a
Mm.
thing of I am too much and yet somehow not enough and I need to change myself and I am the problem and I will starve myself and make myself smaller because it is all my fault.
Yeah. That's
No, it's just an eating disorder waiting to happen.
yeah.
Honestly. And now I'm on my soapbox, which I know is kind of the point of the podcast. I do feel bad. We prescribe to people in bigger bodies what someone in a smaller body would be sectioned for doing. We give 800-calorie diets
Oh,
to
yeah.
people in bigger bodies and tell them to take drugs to be smaller and do all these things. If someone in a smaller body was doing that, they would be held in hospital under a mental health care plan, or like a mental health, I've forgotten the word, order.
Mm.
Because if you are like, that's an eating disorder. That is, behavior that will
Yeah,
result in
why is
happen.
800 calories okay for someone that big?
Yeah, right. Of course it's not. Also, there's more of them. Like fat isn't inert. It's living. It's cells.
Mm.
Like you need to still move in the world. You still have a job. You still have kids. You still have hobbies. You still have a life. You still have a brain. We feed people in comas more calories than that. Like right? It's bananas that we think that's okay. But what happens is that weight gets put at the top of the pile and it's like, well, God forbid they be fat. I'm like, okay, but you're literally starving them and you're
Yeah.
not giving them whatever they actually need,
Yep.
right?
Yeah,
Yeah.
you're right. I'm like actually blowing my mind. I'm like, I've never really heard it in this way before.
Yeah.
Like,
So, and what that means is that people who are in large bodies are not getting the gold standard of treatment.
yeah. Okay.
So a really easy one is like back pain, right? So it's like, oh, someone in a small body or in a straight size body comes into the doctor, doctor, I have back pain. I've had it like this. Okay, show me these things. Okay, right, maybe let's go get you a scan. Let's send you to the physio. Let's send you to the EP. Off you go, thanks. Great, gold standard. Good job, doc. Well done. Person in a larger body comes in, doctor, I have back pain. Have you tried losing weight?
Ooh.
If you weren't so fat, that would put a lot less stress on your body. I bet you're not even exercising. Yeah, that's not the gold standard of treatment.
Yeah, no.
And so then they have to wait longer. I once had a client who came to see me. He worked in an industry which involved him being at a very awkward, very specific desk and having to work around things and move around very awkwardly. And he had had thoracic back pain for 8 years. And he moved around with his job quite a bit. So like he didn't see the same GP all of the time. He had never been sent for a scan. He had never been sent to a physio. And until me, he'd never been sent to an EP. All anyone ever told him was that he needed to lose weight. I gave him the most basic bitch exercise program and taught him how to set up his desk remotely, not shitly. And he came back and he was like, oh my God, it's 80% better already.
Wow. It's a little
That
boring.
man, like, that man could have not been in pain for 8 years. That man could have had a cancer growing in his spine and nobody bothered to freaking test it.
Mm,
Do you know what I mean? Like back
yeah.
pain for 8 years, I'm like, that's a flag.
Yeah. That's a
No, please
problem.
scan that. We didn't need to scan it in the end. It was fine. But like, I'm like, good God. So there's no way and he went to so many different GPs and it was lose weight or would you like painkillers? That was it. So he did not get the gold standard of treatment multiple times,
Mm,
right? Like it boils my blood with stuff like that because then people, all the evidence shows that people in larger bodies do not actually go to the doctor as often, are very reluctant to go to the doctor because they know they're going to get weight stigma and they know they're going to get this bullshit treatment,
mm,
right? And they're actually diagnosed later with things, which means they're more advanced and they're worse and they're harder
yeah.
to fix.
Yeah, more problems later.
More problems,
For
right?
things because it's they were just trying to avoid healthcare.
Yeah. Because wouldn't you avoid healthcare if you were treated like a sack of crap all the time and
Yeah,
not,
100%.
right?
I
And
I honestly say I don't really go because I don't love a lot of
mm,
like Western medicine. So I can relate to that for other reason, but yeah, it's not a nice, that would be terrible.
yeah.
Terrible.
And then you have the intersection. So when we talk about intersection, we talk about the intersection of different minorities or marginalized groups. Okay. So you can be like, white, cis, heterosexual, super, all of the things, but then you're fat, right?
Mm.
Or if you are also disabled, then you have the intersection of all the things that come with being disabled and all the things that come from being fat.
Yeah.
Make sense?
Yeah.
And then you're also black. Great. Now you have the intersection of three different things. And then you're also neurodivergent. Right? Now you have four different things, and it's the intersection of all of those things. That is a person. That is multiple. That's probably thousands of people in the world who are in bigger bodies, who are also black, or a person of color, who are also disabled and who are also neurodivergent. That is literally thousands of people in the world, and they have this intersectionality of all of the things. So not only are you dealing with the stigma and the barriers of one lot of things, you are then dealing with all of those other things on top. So it's even harder to advocate for yourself.
Mm.
Because I think what we really need to remember as clinicians is that we are in a position of power over our clients, right? We have the pretty bit of paper on the wall. We're the one sitting across the desk. We're doing all the things. It is hard for them to advocate for themselves. I see part of my job is to like lower those barriers and to make it as collaborative an approach as possible so that we're working together. Because yeah, like sure, don't get me wrong, I have some pretty pieces of paper and a hexstat, but I don't live in their body.
No.
They're the expert of their own body and their own brain in their own life. I don't bloody know anything about that. We need to work together to work out what's going to be best for them. And I think that that should actually be the very basic bitch standard of healthcare. Unfortunately, it's not. You know, like you said, we're like, oh, your clinic's so cool. It has all these cool things. I'm like, and thank you. Like, I'm very proud of it and I really love it being acknowledged. And also, I really long for the day that no one thinks it's really cool
Yeah,
because I
100%.
just think it should be normal. I think you should call people by their correct pronouns. And I think that you should make sure that your equipment is appropriately weighted. And I think that things should be wheelchair accessible. And I just think that that's what should happen, because if it's not made for the people who are our most vulnerable and need the most help, then what are we actually even doing?
Yeah.
What is the point?
I know, and it really just boils down to like making someone feel safe enough to fix their health. Like they're actively making decisions to help themselves when they
Yeah.
come and see us, right? Like
Yeah.
we should be fostering that in for every single person
Yeah.
in
And that
whatever
is
way that looks like for them.
yeah. And it is an honor and a privilege that people come to us for help.
Mm.
Like for us to be able to help people, that is such a cool thing to be able to do. Like I feel so special that our clients entrust us with this aspect of their healthcare. That is an amazing thing that we should not take for granted. And unfortunately, I think that so many health professionals do. Yeah. And like, don't get me wrong, it's not your fault or our fault or my fault. Like I didn't pop out of my mother sorted. I'm constantly learning. I bugger it up all the time.
Mm.
What I think is really important, my friend says this all the time. I used to say the phrase know better and do better, and she actually pulled me up on it. Shout out Alana Riley when you listen to this. Excuse me. Is that she says, no, it's not better, it's just different. So when you know different, you should then do different. And if
Mm.
you need to go learn different to be able to do that, then you should do that. So you should learn different and then know different and then do different. You got to walk the walk. It's about improving on it and changing it slowly but surely. And I think that's what's really important. Like we can't, of course, it's ingrained in us in society. It's from society. But when you go, oh, that doesn't sit right with me. And oh, I can see that that was really upsetting for that person. It's about then having a hot think for a minute and then doing something different.
Yeah, I think so too. I even just having the awareness around it, I think
Mm.
is like the first step. Like being aware of like the chair, even just the chair thing. I don't think that would have, unless until you see it and you think, oh, I never realized that was actually something that people worried about in
Yep.
those
All the
scenarios.
time.
Yeah, you just don't, unless you've that's where I guess lived experience for some clinicians with why they help certain populations makes so much sense because they understand those deep ingrained feelings that are important to that person. Like you said, you haven't had this for yourself other than maybe what you've been exposed to earlier in your life. But for me, I haven't either. So I wouldn't think until I've seen it as, um, something to address until it's like happening in front of you. And you're like, oh,
Yeah.
shit, the
Yeah.
chair.
The chair.
I
Yeah.
get it now. Yeah.
Yeah. And then the main thing is to then go, I tend to, if something's not going right, I kind of call it out in the room and I'm like, oh, I can see that that didn't work so well. Okay, cool. You know what?
Yeah.
I'm going to do something about that for next time.
Yeah. I think
And
I would do that. I've done that a
yeah,
couple of times in my history where I'm like, oh, that's not really working. Let's change that.
yeah,
And
right. And
making it
that's
like
fine.
I'm happy to make it happen and I didn't get it.
Yeah. Because you're a human working with other humans. Like it's messy.
Yeah, so
Not
messy.
going to be, it's not going to
Especially when you
be
don't really know them at the beginning, right? Like,
right. Yeah. And it's about, doing the best you can with the knowledge you have. And when you have more knowledge, then you do it differently.
hmm, yep,
That's the main thing.
yep. There are so many other topics that I feel like I want to talk to you about, but I feel like there'd be potential future episodes because I'm like, this is already so much. Um, But this is something I think a topic that I know so many clinicians are probably like, how do I like it's a bit scary to like get this right in the beginning.
That's fair.
Like how do you like if someone's listening to this now going like, wow, I just realized like me, I need to change a lot of things. Like where would you even start, especially a clinician in someone else's clinic who isn't like this? Like,
Yeah.
an owner who maybe doesn't vibe with this.
Yeah. And like there's a lot of privilege in me being the owner. I get to do whatever the hell I want.
Yeah, that's what your
Yeah,
mum
I don't
said.
like it.
Sail
We
your own
change it.
ship.
Like, yeah, captain, ready to go, ready to change whatever needs to be changed, right? The really base level piece of advice that I tend to give students or clinicians is to start not seeing and putting into your brain through various channels different people with different bodies and different experiences. So if you're on Instagram or TikTok or I don't know, Pinterest, whatever the hell you look at, whatever the kids are looking at these days, stop just looking at people that look like you.
Mm,
Start looking at people who have a different body to you. Start looking at people who do different activities to you. Start
mm.
looking at people whose brains work differently to you. Or if you listen to podcasts, start listening to some different content creators who are not just a carbon copy of yourself, you
Yeah,
know,
which is hard to
which
find
is
with like
hard
you don't see
sometimes.
that, right? With the old algorithms.
Well, and I was about to say, and you're so right, because it's the algorithm that drives it. That
Mm.
doesn't mean it's not out there. It is so out there.
Yeah, because like I just think about my platform and my page, like I wouldn't like my stuff on my Instagram is literally full of just like pelvic health. Like I don't even see anything out that at all because that's all my content and the stuff that I would interact with. And I can see that other people would have the same things. Like I would have to actively search and start looking and following and making a very solid effort
Yeah.
to change what that even looked like.
Yeah, and I highly recommend doing that. Start following, Black and Indigenous people of color and disabled bodies and neurodivergent bodies and queer bodies and bodies that are bigger, fat bodies that are literally just existing. They don't have to be doing anything particularly amazing. It's all these tiny little things of not being used to working or seeing people who don't fit the mold that the really weight-centric version of society has given us, right?
Mm.
Look at other things. Look at all these other different bodies doing all of these really cool things. Listen to people, watch movies that involve the fat actor not just being the person who falls down and is really funny and is the butt of all the jokes. Watch something where they're the main character.
Mm.
Watch something where all of the main characters are African American. Watch something like anything, right? Like just get it in your eyeballs and in your ear holes so that it starts to not become an anomaly and starts to become part of the fabric of what you're expecting.
Mm.
That is my absolute base thing that I always encourage people to do. Because as soon as you have that starting to happen, you will start to notice all of the things. And when you start to see the weight stigma, you'll be like, that is atrocious. I cannot believe that happened.
Mm.
Start to see that. So that is my baseline thing. In terms of very practical things, you know, ask if you can have curtains to put over the mirrors. They don't have to stay there all the time. Or work out in your gym space where the best spot is going to be that you can face a client who doesn't want to look at the mirror.
Mm. Do you think just on that point, is there I'm just thinking about old clients, like older, like people I've seen before.
Yeah, previous client.
Like previous, that's the word I'm looking for. Previous clients where, like, I don't know if they would say anything to me. Like, I would either just generally pick up on their vibe, or is it like, is there things that we can say, like, do you feel like, do you want me to, do you want
Yeah.
to cover these mirrors? Or
Ask
is there anything
implicit.
that you don't like doing?
Yes. Ask consent every
Yeah.
single time for everything, so rather than like, for example, all right, so we're going to weigh and measure you. That okay with you? You've actually already said it as a complete sentence. You've said, we are going to weigh and measure you.
Mm.
That is a big hurdle to jump. Can you tell me how you would feel today about if we weighed you? Here are the reasons why I think we should. And if you cannot give them good reasons, you need to back the hell out of there and you should never have offered it in the first place.
Yeah, okay.
right? Do you know what I mean?
Yep.
And it should every single time being like, and I'm going to explain what we are going to do, and then I'm going to make sure you're okay with it, and then we're going to do it. I would just blind weigh people. If you want to weigh people, that's fine. I would just automatically blind weigh them
Yep.
personally. And things like, would we feel more comfortable being in front of the mirrors, or would we feel more comfortable being over here away from the mirrors today?
Yeah. Okay.
That's a really innocuous question. It's the same as, would you feel more comfortable starting with legs today, or do you think we want to start with upper body today?
Hmm.
Just in that real super chill thing,
Yep.
that hamstring stretch idea. Okay, and so we can do it like this. Now, if we feel like we don't quite have enough room, we can have our legs out to the side, and then we've got a bit more room for our belly. And I often normalize it with something like, I really like doing that if like I haven't gotten to pee for 3 clients, or like my
Yeah.
uterus is a real asshole today. Then you've got room for yourself.
Yep.
So it's those sort of things. It's that real, just like, don't make it a bother. Don't make it sound like they're annoying you. Make it sound like it's the most normal thing in the world, for it is. It is. Your client is the person in front of you, and you should be adjusting your program and how you prescribe for them. You would adjust it from a bodybuilder to your person with Parkinson's. You're not going to give them the same damn program. It's the same with someone who's really small versus someone who's really big and everything in between, or someone who's really short versus someone who's really tall. Are you going to put them on the same equipment? Are you going to cue it the same? Of course you're not.
Mm.
Because we have this whole thing about weight of, it's like, oh, well, but they should just fix that.
Sometimes I think there's this feeling of I don't want the person to feel uncomfortable if I address their weight in a way to make, like, I'm thinking of someone that I've trained as a personal trainer before I even went to uni, like back in the day. And I think I would have been nervous to say, oh, we don't have to do that machine. Like, I'm thinking the leg press, that one where it comes down and you just like everything's in the way.
Yeah.
And I didn't want them to think that I was making them, like, I didn't want them to, like, I just didn't want to
Yeah.
bring it up.
Yeah. And I can
Like,
really understand that, because, see, this is the thing, right? We all know that people who are in larger bodies get crap about their weight all the time
yeah,
because you were worried about it.
I
You
felt
didn't.
nervous to be like, we don't have to do that or like change this exercise because I didn't want them to think that I thought they would find it uncomfortable.
Yeah. So you can present it as an option. So leg press is such a really good example. Okay, so this
Hmm.
is how we do the leg press. Now, if that happens to feel uncomfortable because we are different shapes and we all have different bodies, you can try this way or you can try this way. If this isn't comfortable, I have like 2 other options that are basically exactly the same thing, and we do it.
Yeah, okay.
Right. And for example, if you're in a gym with a lot of different equipment, you can imagine that doing the leg press where you're sitting dead upright,
Yeah, like
I
the
find
horizontal
that
one.
uncomfortable. Don't
I
do
hate
that.
that.
Put them on the damn incline one, because you know it's going to be better.
Yeah.
Do you know what I mean? Like, pick your battle already. So you do half of the work without them even needing to do that, and then just present it as an option. Or, if it's a new client, ask them in the initial, how you're like, are there any particular types of exercise that you really love or you find really work for your body? Are there any particular types of exercise or machines that you find you really hate, or that they really don't work for your body?
Mm. See,
Honestly,
I would go to this like, I don't want to address the body thing. I don't want to assume that they have a problem with it.
but you're not a shit. Then ask everyone.
Yeah, true. Well, I do, but I feel like my brain already automatically goes to this like,
Yeah.
that's
So
the
if you're
problem,
not
right?
asking them, which I get is coming from a really, really good place of like, I don't want to insult you, but if
Yeah.
you're not asking them, are they getting the gold standard of your treatment?
Yeah. No, no, like
Right?
technically not.
Yeah.
Yeah.
So ask them. You ask them in a kind way. Don't be like, so Courtney, because you're so fat, I'm a bit worried that this piece of equipment isn't going to be super comfy for you, because obviously you've got all these rolls and that's probably just really not going to work. So I don't think we're going to do that exercise. For the love of God,
Can you
obviously do
imagine?
like that.
Imagine if I rang you next week, I'm like, guess what I said? You're like, that was not what I told you.
I'd be like, all right, I think I need to come and see you.
I need some lessons.
Right. But it's that thing, right, of if you do it in a kind and compassionate and client-centered way, that is actually what you're doing. Of course, you want your client to be comfortable on the piece of machinery. It's the
Oh
same
yeah.
back pain, right? Are you more
Yeah.
comfortable with this piece of machinery or this piece of machinery? If it's not comfortable, try it like this. It's just a body.
Yeah.
It's,
Doesn't that just show you though how deeply ingrained in our society it actually is? Because
yeah.
like your brain goes there.
Yeah. And the fact that you're worried about it is such a good thing, because it means
Yeah.
that you're like, I know deep in my soul somewhere that people are real assholes about this.
Yeah.
And you're
Well,
trying to not perpetuate it, which is really, really great.
yeah.
And they still need to work out.
Yeah.
Or they still need to get in or out of the chair. So, like a sit to stand is another really good example rather than doing it like train tracks. If you've got a bigger body, I tend to be like, so I want your feet, knees, and hips in line. Now, that can be in line dead straight like this, or I show them it can be in line wide like this. See how they're still in line with each other because we're going to lean forward. And so, when we're getting off something really low, that can be better, but it can also be better if you've got a bit more of yourself and it makes room for yourself. That's
Yeah.
always
Like
a phrase that I
wider
really
stance.
like. I want to make room for myself so that I'm comfortable. And they're like, oh, I think I'd like to do it wide like that. I'm like, great.
Yeah.
Or if they're like, no, I'll try it narrow first. I'm like, great. If it doesn't work, let me know.
Yeah.
We do
Cool.
it wide. Like it's a very neutral, it's just very practical, right? You'd
Mm.
say, give an adjustment if they had a fused ankle. You'd give an adjustment if they had a prosthetic leg. Do you know what I mean? It's that
Yeah.
same thing. Like now, if your ankle doesn't go that way, we're going to try it like this. And if that doesn't work, we're going to try it like this.
Yep.
It's the same. You're just working with their body. And the fact that you're working with their body as they present to you now as a human is actually, that's the respect. That's the thing that you're doing really well. If you are just like, oh, we're just not going to do any of that, or like, oh, hey, mate, if you could actually just go and take all these protein shakes or go on,
Slim
what
fast. Then
yeah,
again, great.
have some slim fast and then come back then and then I will teach you because I just can't think of anything other than the leg press to do. Honestly, you're really shit at your job.
Yeah.
Our whole job is to work around it. They are not a problem to be solved. They are a human for you to figure out what works best for them. That is our whole job.
Yeah.
That's what we should
Amen.
be doing, right? And so it's fine to be like that. They'll probably know what works for them and what doesn't work for them. Ask them. In the past, has anything really not worked for you? Or is there anything here in my gym you can see that you're like, that's a hard no? And if they're like, yeah, I fucking hate that thing over there, then it's like, no, well, don't do that.
I feel like I've heard a client say that to like every exercise. I'm like, I feel like this is actually exercise that you have a problem with, not the actual movement.
Yeah. And so then the next
Yeah.
part of our job is to then go, well, why is that? Can you tell me a bit more
Yeah.
about that? Use your bloody motivational interviewing skills.
100%.
Figure it out. Work it out with them. Why is it that you don't like that? Because I got sent to, I had a client a few months ago who realized in our second or third session that she was like, yeah, when you kind of really talked about all that with me and unpacked it, I went home and I thought about it and I was sent to fat camp as a kid.
Oh,
And that's where I learned to hate exercise in my body and decide that my body could not do exercise. And I was just like, I am so sorry that that was your experience. And she's like, yeah, that's not a thing we're doing anymore. I'm like, great, let's figure it out.
yeah.
Let's figure out a way to make this work for you and your body as you are now.
Something that you
Right?
might even enjoy doing. Which one
Yeah.
of these?
And look, if you never enjoy it, fine. I'm aiming for neutral and better.
Yeah, we're moving for the fun of the rest of life. Remember, move to live.
Move to live, right? Like sometimes what we do with people is not fun. You have people with persistent pain all the time. It's
Yeah,
not fun when they move,
no.
not joyous, but the long game is going to move the needle on their quality of life.
Oh,
Sometimes
yeah.
that's the thing. So I don't really care if you love it. I care if it's tolerable and I care if you're neutral and better about it. And if it's not bloody traumatizing you in any particular way. And if it works for your body, if it's ticking all those boxes, I'm good with that because our aim is not actually for you to be here in the gym 3 times a week. Our aim is actually for you to be able to handle that Kentucky tour that you've booked yourself on. Or our aim is for you to be able to pick up your kids. Or our aim is for you
Yeah.
to, whatever it is, insert thing here. That's the thing that I care about. What we're doing, it's just a step on the way.
It's a therapy,
It's a
really.
therapy to help you
Yeah.
get there or as close as we can.
Oh no. Well, Meredith has just dropped out of the Zoom call, so I'm going to assume that her battery on her laptop died. But we are going to get Meredith back in anyway. She does a lot more in the eating disorder space as well. So I would love to talk to her about that. But anyway, I will end the show here because I don't think she's coming back. But stay tuned. Thank you for listening wherever you are. I will say thanks to Meredith on my own. That's fine. But if you do want to find a little bit more about Meredith, she is moved to live, and I will link all of her details in the show notes so you can access her ways to contact her. But I know she does do a lot of education, or she's looking at doing more education. So if you're in a clinic and you might want to learn more about this or have some PD presented, you'll be able to reach out to her. But otherwise, thank you again from wherever you are, and I will see you in the next one. Bye.